Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we have the newest member of the team with us. This is Dr. Zander Romero. Alexander Romero goes by Zander, and I'm so excited to have him on this podcast because he is a wealth of knowledge and really adding value to our practice. And I know he's going to add value to you guys today. So thank you so much for being on the podcast.
Yeah, this would be awesome.
All right. So what we're going to talk about is really the neuro side of headaches and migraines. So when I say neuro, I mean, we have a mechanical issue that has to do with neck, jaw, and shoulders. Within physical therapy, we have the scope to look at, evaluate, and treat other elements of the experience that someone might have after like a concussion, or even it could be like a TBI, or what happens when these different systems in the body have a level of stress through them. And when they're stressed out, when they're dysfunctional, how do they present, and how can we restore that? How can we rehab that outside of just the mechanical component? So Dr. Romero has lots of experience in this area. On a more practical level, this is talking about dizziness, nausea, eye tracking, different things that could really impact someone's situation. Dr. Romero, why don't you start out by telling us different sort of daily scenarios? Like, what are the types of symptoms, things that patients would say that cue you into, like, there might be an element here that I need to dive deeper into as far as the neuro component of headaches and migraines?
Yeah, for sure. So there's three main systems that your body uses to let itself know where it is in space, right? So you use your eyes, you use what you feel, so your proprioception, what you feel through the neck, through your legs, touching this chair right here, I can feel where I'm at. And then also the vestibular system, that's kind of more of your internal gyroscopes within your head. And so those three things come together and your brain processes those and lets you know where you are in space, right? So you're constantly using those. Driving's a good example. Going through the grocery store, swimming, on a boat. Sometimes when you get that seasick feeling, right? You see the horizon not moving, but the boat's moving. So just some instances where your body's constantly using those systems to figure out where it is.
Yeah, absolutely. And it's very common for us to have patients that feel like they're on a boat, they have dizziness, they have a hard time driving, and their symptoms will increase with these scenarios. So when it comes to, as a clinician, evaluating these types of scenarios, what are some things you look for when you're going through your evaluation process?
Yeah, for sure. So first we can start with the eyes. So you can look at how the eyes lock onto something as it's moving. So we call that smooth pursuits. Right. So a lot of the time I'll have my finger out and I'll move it in a figure 8 pattern in front of them. And I'm just looking at how smoothly the eyes are tracking the finger. If there's any overshooting, undershooting of the eyes. Also, you could look at, for example, when you read, you're not necessarily smoothly tracking. You're jumping from one word to the next. Right. So that's called a saccade. So just a couple different movements that we look for in the eye. Also, with the vestibular system, you can look at how well they balance, how well they're able to feel where they are. So a lot of the times you can isolate that with changing the surface. So whether they're sitting, laying down, those give you more feedback through your proprioception. So your vestibular system doesn't have to work as hard, right? Whereas if you put foam or have them standing or staggered stance where you narrow the base of support, your vestibular system has to work harder, and so you can really isolate that. So just a couple different ways we can test the vestibular system in the eyes.
Yeah, absolutely. And let's get into maybe another layer of complexity, or things like the normal reflexes that our body uses to help our eyes and our vestibular system coordinate. Can you go into a little bit of that, like the VOR and things like that?
Yeah, for sure. So there's something called optokinetics, which is a natural reflex that your eyes have as things are moving. If you think about when bars are on a screen and they're sliding sideways or up and down, your eyes kind of naturally jump to the next thing, right? It's like when you're driving and you see those hash marks in the road, your eyes are constantly going back and forth between the next dash. And so that's called optokinetics. Your brain is constantly processing how to use what it sees, what it feels, and then the vestibular system as well to basically have the best result in how it interacts with the world. And so, so optokinetics, you can really bring that out. Recently, treating patients, we've been using some roller coaster videos, right? So it's like a first person point of view of being on a roller coaster, because there's lots of objects passing by you, like especially the tracks, trees, maybe birds in the air. And yeah, you're teasing out those optokinetic movement patterns and seeing how the body reacts to it.
Yeah, absolutely. Now talk us through why these things would have issues in the first place. Yeah, like what sort of injuries or impairments, maybe lifestyle habits, would lead to someone having the sorts of impairments that we're talking about?
Yeah, for sure. I think a common one is concussion, whiplash. Okay. So any kind of physical trauma to the head, that's very common. Also, immobility as a whole, right? Being sedentary. Not using those systems, kind of like with any muscle in the body, right? If you don't use it, you lose it in a sense. So if you're in an environment where you're constantly using those systems, you're training them up. So a good example is with kids, they're in like the merry-go-round, they're always going up and down the slides, the swing. They're always constantly training those systems in a sense. And then, as we go throughout life, you're more likely to not be in those predicaments in a sense. And so those things can almost like you're under training them in a sense, right? So same thing with concussion, either the sedentariness. That's kind of the background of how those systems can become impaired.
Yeah, and before we jump into what treatment itself would look like, I want to talk a little bit about the research you did on green light and its therapeutic effects on headaches and migraines. And before we jump into that, though, Novera's logo is green. So if you look on our website, if even on this podcast, we incorporate the color green because of these therapeutic effects. But when it comes to the environment that someone experiences treatment in, I love the things that you've been implementing, and I want you to talk a little bit about the sensitivity to light and what you do to accommodate to that, and then even sounds and how those have been therapeutic, like we talked about over lunch today. So,
no, for sure. So usually people that have headaches and migraines, they become more sensitive to light, and so that's called photosensitivity. And so the research shows that the green light spectrum has the least it actually doesn't flare up those symptoms as much, right? It's like softer on the eyes, so the brain is able to process that better. And so they actually did a study with some rats where they made them some custom contact lenses in a sense, and it only allowed the green light to go through, and they had improved pain threshold just overall, right? So the green light is actually pretty useful, and so we can look at things like that. So that's called sensory integration, right? How you're able to integrate the senses from your eyes. So that includes the light and then the motion, what you feel, proprioception, and then your vestibular system, and use those to our advantage to create a window of opportunity to train. So they showed in studies, or one study, that being exposed to green light for about 1 to 2 hours a day improved the frequency and intensity of the headaches and migraines. So it could be very beneficial to use that to as a window of opportunity to train in that zone, right? Or even just get through your day-to-day life, whatever you need to get through.
Yeah, absolutely. What about sound?
Yeah. So sound sensitivity as well, right? Any kind of input that your brain has to process, it becomes more work, it requires more energy if these symptoms are flared up. And so that's why you can get that like icky feeling, and not like maybe more irritation if there's more side conversations, or for example, going to the grocery store, if there's a lot of people moving around, concerts, theme parks, where there's more motion, movement, sound, increased brightness, lights. Your brain is having to sift through all that and really figure out like, okay, what's a threat? What am I processing right now? Is this, because in your normal environment, your home, even a dark room, you're used to it, right? There's not as much to really process and think about. Whereas if you're in a new environment, your body always has to go through that, right?
Right. When it comes to Yeah. So you mentioned just earlier today a patient that your the theta
Oh,
wave,
yeah,
right?
right.
So like,
Yeah.
tell us a little bit more about that.
Yeah. So usually, if you're in that fight or flight state, right? So there's two main states that your autonomic, so your automatic nervous system's going through, right? Fight or
Yep.
flight, rest and digest.
Right.
So your body heals best when it's in that rest and digest state.
Okay.
If it's always in fight or flight, you're not really gonna be able to recover as efficiently or effectively. So what can help is creating an environment that's more favorable towards that rest and digest. Thus, the green light, darken light, right? So mitigating light and then having the green light there. And then using some different like meditation-like sounds like theta waves, beta waves, depending on, what you prefer. And creating that environment where the nervous system can calm down. It's not constantly thinking it's in danger at all, where you're not looking for threats. That is a perfect window of opportunity to implement some treatments just overall, right?
Yeah, absolutely. And if you haven't listened or gone on Spotify and type in like theta wave soundtrack, something like that, it's very therapeutic.
Yeah, you can even go on YouTube. YouTube, type in theta waves.
Right.
They have some cool backgrounds. They have
Yeah.
some relaxing backgrounds, and the visual input can be nice in that regard too, right? It's just like extra flavor. But yeah, I mean, even just playing that on when you feel more stressed or symptoms are very elevated, it can help calm down the nervous system and thus improve the healing process.
Yeah, absolutely. Okay, so some of the treatments that you've been implementing with different patients have looked kind of fun or entertaining. And so I want you to talk about when you find these impairments, what are some things you're having people do to try to accommodate these systems to what would be normal?
For sure. So when there is something that we need to uptrain or there's a deficit, the simple like forward way to go about it is that, okay, we just need to do that thing to train it. For example, the muscle or the bicep, if there's difficulty curling up a certain amount of weight, you start curling weight to slowly progress to that weight, right? So same thing with the nervous system, same thing with the eyes, the vestibular system. If there's a deficit with, driving makes me nauseous or sick, right? Then we can look up videos of driving, just, point of view or first person point of view driving. And you just slowly start introducing your eyes, your system to that stimulus. And you go up until you feel about a 4 out of 10 symptoms. So 10 out of 10 is the worst, right? So it could be nausea, dizziness, neck discomfort, back pain, whatever it is. You train that to that 4 out of 10 threshold, and then you back off. You just take a break, and then you go back to it. And then once you get to that 4 out of 10, you take a break again. So you're, again, just like with weight training, you're just slowly training up the nervous system in that way.
Yeah, you've connected with a few patients on video games.
Yeah,
so that's kind of cool.
Yeah.
Yeah. So you said split fiction is a good one to.
Yeah, there's some good ones. If you're looking for more smooth pursuit across varying backgrounds, you can look at 2D scrollers, so like Mario. Depending on the Mario now, but Mario, Split Fiction's fun one. I actually played one with my wife, and we just beat it. It was great bonding time. So yeah, actually a lot of these video games, especially if there's a lot more movement and flashing lights, things in the background, you can kind of progress your way up into those. But yeah, a good way to start is just with a 2D scroller, if that's something that we think would be beneficial for them. And just accumulating that training over time. That way it's more fun rather than, tracking your finger, for 20 minutes straight, right? You could play a video game and have some intellectual stimulation as well.
Yeah, absolutely. So going through a treatment process like this, what should people expect? So there's a few scenarios. I could see people thinking, okay, I'm sort of intentionally stirring up my symptoms, so is it going to get better before it gets worse? Or should I expect some quicker, more immediate results? What should their expectation be when someone comes in, they're in this debilitating state of like nausea, dizziness, pain, and we're starting to do things that sort of push into that.
Right. So it depends on a few factors. It starts basically where your starting point is, right? So I've had some patients that have, started with walking around in, hiking poles and sunglasses, and they could only go out to maybe the mailbox, come back in, and then they hibernate for the day, right? And then over the course of time, they go to not needing those hiking poles anymore or the sunglasses, or just going, like maybe they just do 2 errands instead of just 1, right, for the day. And so those are things you look at when you're talking about starting point. Also, it's usually a snowball effect in that once you start clearing up some of these neurological issues, along with the mechanical issues that we're treating, right, with the manual, the motor coordination exercises, those things combine, and a lot of the other symptoms start clearing up. Because if you feel better, you're able to move better, and if you're moving better, you're able to address those neurological issues, and then you're move better and feel better, right? So that those two things keep spiraling together, and they dovetail nicely. And so there's that. So depending on where your starting point is, how much activity you can tolerate for the day, you can usually expect the symptoms to flare up after some of the vestibular training, especially if we just introduced that. So the sensory integration things, the roller coaster videos. That's why we try to say, stop when you reach that 4 out of 10. Sometimes it's hard to tell what your 4 out of 10 is until later that day you're just wanting to sleep, right? Because your symptoms got elevated. So just like with working out, you get sore after stimulating those muscles. Same thing with this. You may elevate some of the symptoms at first, for sure, because you're still figuring out what a 4 out of 10 is. And the whole point of that, why we say 4 out of 10, we don't push you to a 10 out of 10, is so that you're able to still do things throughout the day. You still got to do your errands, your chores, whatever it is. And so you can expect the symptoms to elevate a little bit following, depending on how much we challenge you for the day. And then those will start clearing up as time goes on, as the treatment continues and you keep consistent with it.
Yeah, that's great. You hit on it a little bit. Talk more about how this approach, taking more of a neurological adaptation, challenging the nervous system in this way and these different systems. Talk about how that really complements and harmonizes well with the manual therapy that we do in restoring neck function and restoring mobility, things like that.
For sure. So if it is a true mechanical issue or deficit that we're addressing with the manual, the exercises, it's harder to implement movement throughout the day. So, we say motion is lotion, right? Motion is medicine. So the body likes motion. It's just a matter of how to move. And that's part of our job, right? We're teaching patients how to move efficiently. And so with the dizziness component or nausea component, eye component, for example, if I turn my head and I get dizzy, I'm then less likely to turn my head because I don't like being dizzy, right? I don't like being nauseous. I don't like the sensory conflict I get with that. So if we can clear up some of those neurological symptoms, it allows or encourages some more movement throughout the day, allows you to have more energy to delegate towards your exercises that you're doing for the suboccipital muscles, the cervical paraspinals. And so it complements that nicely. And or if the neurological components are the main issue, then we're just addressing it head on. So it's beneficial either way. Plus, you're able to have more energy for other activities just in general.
Yeah, absolutely. Okay, so is this the type of thing that I want you to speak to? Because people listen to this podcast and from all over, and they're looking for avenues that they can maybe hit on treatments in their area, or like things they can do at home, takeaways of like, okay, what can I do with this information now? So what I'm looking for are maybe helpful tips and tricks for people. Just okay, listen to this podcast, go ahead and try this to maybe help your own situation, or if there's someone in their area that maybe they can go to if they present in a way that seems like this might be helpful.
No, for sure. So 2 that come to mind that pretty much anyone can do. So first you can ask yourself, do I get nauseous or dizzy or just general discomfort with driving, right? Whether it's a passenger in the back seat or actually driving or on the bus. Do I get those nausea, dizziness symptoms? And watching movies with maybe shaky cameras, or even watching, a family member or friend play a video game, if with those constant visual changes, it's a matter of, do you get those symptoms? So you can ask yourself that. If the answer is yes, again, you can just go to YouTube, look up whatever it is that makes you dizzy or nauseous. So if it's driving, look up, first person point of view driving video, right? Make sure it's good quality, because sometimes if it's bad quality, that can make you dizzy in itself or nauseous. So making sure it's good quality, usually look, 4K, HD, whatever it is. And you're gonna, you stand, feet together, have the laptop or TV eye level as best you can. That way you're not, cranking your neck as you're doing it, and just watch the video. And then again, stop when you get to that 4 out of 10 symptoms, something very specific to the activity, right? It's functional. So there's that. And then as far as the vestibular system, you can find a pillow at home, that's rolled up towels, blankets. I've had a patient use a squishmallow before, and you just stand on it, feet together. See if you get nauseous, dizzy, or if you have some postural sway. Those things can indicate that, we just need to train up the vestibular system. Most people can benefit from some type of vestibular training anyway. So just 2 helpful things you could probably do, today.
Yeah, absolutely. And just so the listener is aware, it was last year I went through a course on a lot of this stuff specific to the vestibular system and dizziness. And, as a becoming the patient in the scenario where, you role play and they're taking me through a test for vestibular ocular reflex and looking at if my eyes are able to lock on to something in the distance while my head is turning. And I realized I was awful at it. And there are all these things popping up. So I've had a few concussions from soccer, and people ask me if I get migraines. And I didn't start Novera because I got migraines. I started Novera because I saw the opportunity to help people that had these debilitating symptoms and weren't finding answers. But come to find out, I have things that I need to work on myself, and I can testify to the fact that you can compensate really well. Mm-hmm. And so going through these tests, you start to realize I'm compensating at a level that, the systems are being taxed sort of constantly. And so there's an underlying level of, you're always on the edge of being nauseous or dizzy. And it doesn't take much to push you over that edge. And so if we can test these things and they reveal themselves in these different settings, then let's challenge those and build up our tolerance to them. Anything else that comes to mind, Dr. Romero, as we think through this, or anything that my questions didn't necessarily pull out that you wanted to talk through?
Yeah, so I think that was a good point. They said how you can compensate for it. So usually athletes are really great at that. I've had some, gymnasts, athletes, whatever it is. And as soon as they like, oh, I have great balance, this is what I do. And you just pull out the foam pad, have them stand on there, close their eyes, and then they're swaying all over the place, right? So, exactly. So people can compensate for it. It's important to really tease out the specificity of the system, see if there's one that's lacking or not pulling its fair share. And then good news is you can address it, right? Pretty straightforward, consistency. And you could feel a lot better after you train it up.
Yeah, absolutely. All the systems, they don't work in isolation. They work in conjunction with each other. And so one system being impaired or dysfunctional is going to put a tax on the other systems to try to pick up the slack. And so the neck also plays into that. There's a lot of people that have a high level of tension. Why don't you speak a little bit to the tone or tension that people present with, and then like the upper traps or something like that? How would we approach that?
Oh, for sure. So again, if you're dizzy or nauseous with turning or moving or certain movements, then the musculature around there is just going to get stiff because you're not going to be moving, right? So that could be the actual joint capsules themselves, could be the musculature around that. And so again, usually, especially if it's been, chronic issue where patients have been dealing with the dizziness, nausea for a long time, and they just feel like the best relief they can get is just locking themselves in their room and, just sleeping, and not, trying to manage how much they move. you're going to expect to find some tight, also mid-back, right? Thoracic spine, cervical spine, upper traps, suboccipitals, all the surrounding musculature that supports the head on the shoulders, because first, you're not using it, right? So usually tight muscles are weak muscles. And then also because the symptoms are elevated with that. And so you're not going to, have a lot of strength in those muscles.
Yeah, absolutely. So it's all tied together. And here at Novera Headache Center, if you present with dizziness, with nausea, and you have yet to find a solution, Dr. Romero might be the guy that you need to see. And I'm going to even go so far to say as he is the guy you need to see. So reach out to us and let us know if we can help you here at Novera Headache Center. And we would love to do just that. Our number is 719-598-1010. You can email us, hello@noveraheadachecenter.com. And we can start with a free visit. It's a free discovery visit. There's no risk. You get to chat with us, one of the providers here, and then we talk you through our process, and we problem solve with you. It's a really valuable half hour, and I would encourage you guys to take advantage of it. Thank you so much for being on the podcast, Dr. Romero.
Yeah, thanks for having me. It was fun.
All right. So for the listeners out there, if you could share this podcast, leave us a 5-star review. It helps the algorithm. It pushes it out there, because we are on a mission and we're not stopping in order to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. We'd love for you to be a part of that journey with us. Thanks so much for listening, and I'll see you next week.